assalamu alaikum, good morning, khushamdi, ji ayanu, goeiemorgen.
Bakhairagale, ni hao, junashimme, washmale, ohaya gonzaimes, guten morgen, hola, bonjour, privet, kaifa hal, halishama chatore, ahlan wasal marhaba, buna, mucho, gracias, suavia, and a very amazing good morning to everybody who's tuned into PTB1 and watching World this morning, alongside the very amazing, the very fabulous, the very talented Shiza Hashmi and Shahzad Khan. Hello Shiza, how are you today?
I'm absolutely great. Thank you so much for asking. How have you been and how are the winter mornings for you?
Yeah, I feel great, and I think that winter mornings are the most difficult to cope up with because in summer you're generally in an air-conditioned room and you really feel like going out, and it's just normal.
Right.
You do not have to look for your slippers. But now I think that my life is in a very different kind of phase. It's because of the fact that every morning when I wake up, I actually have to look for my slippers because the floor is so cold, and then my mom's yelling at me, oh, why don't you wear slippers? You will get flu and whatnot. And then the best part, so when you're getting ready and you're taking a shower, that hot or lukewarm water actually does not really let you go out of the washroom as
Oh,
well.
I
So
know.
it's a little difficult, but we have been telling you that we really need to save water because by 2025, yeah, there are lesser chances of Pakistan having water. So yeah, be careful.
Yeah, and it's not just about the water. I mean, with water changing, of course, the world
Yeah.
politics will change as well. That's a totally different story. But
Yep.
ladies and gentlemen, talking about winter mornings,
Yep.
for all the parents who are sending their children out to schools, including you, Shazad.
Yeah.
I mean, so many different kids come to school from different backgrounds, different areas, actually.
Yeah.
You have no idea which ones of them might be carrying a virus or something. I
Exactly.
mean, because, of course, it's the season.
Yeah.
So just, stay careful and take care of people around you.
Exactly, and I've been talking about it a lot, ladies and gentlemen, because I suffer through it a lot as well, because I have some immunity issues, which I have disclosed on television multiple times. But yeah, for people who are actually suffering from flu, please make sure that you do not shake hands, hug somebody else, or share your utensils or anything of that. So
Right.
please don't do that. I mean, it's just a matter of 5-6 days. You can tell the other person that I'm sick or I'm ill, and I do not want you to get the same disease. So please, it's a humble request, don't do that.
Right. So 14th of November, ladies and gentlemen. Before we actually
Very important
introduce, yes, before we actually introduce that, it's a just small funny story. So when I was little, we used to know, or we were told that 14th of November is supposed to be Children's Day. But ever since I grew up and I came on TV, we've never celebrated Children's Day.
Children's
just
Day?
saying.
Yeah,
Just saying.
I think that we need to celebrate that because back in the days, I think that the parents themselves were so happy that they had so many other children that they actually forgot to celebrate the Children's Day. But now I think in near future we can do that.
All right.
But even other than that, other than Children's Day, Shiza, I must tell you that it is on 14th of November, Sir Frederick's birthday.
Oh,
And
all
when we
right. And why
speak-
is that important?
Yeah, so when we speak about Sir Frederick, ladies and gentlemen, he was one of those gentlemen. He was a co-founder of InsaLink back in 1922. And this day is actually dedicated towards him because of the fact that this day was even opted by the United Nations to actually observe World Diabetes Day. But the initial phase was that back in 1991, IDF actually initiated with this one as well. And then, in 2006, UN adopted the resolution. They reach out to a population of 1 billion people. And
Right.
other than that, the best part is, well, it's not the best part, it's the worst part that out of every 5 people, 1 is diabetic. And the worst part is that a lot of people, even till date, does not know that they have diabetes. And people who have diabetes are taking it very casually.
Right, absolutely. And that is what we're going to be talking about throughout the show today, ladies and gentlemen. We'll speak about different types of diabetes, symptoms to find out if you are diabetic,
Yeah.
what to do if you are, and the myths, we'll sort of bust them if we know any of the
Yeah.
myths, and some common misconceptions as well, we'll remove them. But speaking of this campaign on the 14th of November, it's the largest campaign by the United Nations or by any other organization
Exactly.
held throughout the world because it reaches out to so many different people, of course, and it brings spotlight to, the political importance and the existence of this specific day in today's arena.
Exactly, which is why, ladies and gentlemen, we actually are going to share a small report. But before we do that, I think it is very important to let everybody else know that diabetes is a disease which is very manageable. And it's not that oh, your life is over or anything other than that. But as a matter of fact, I think that people who are well aware of this disease can cope better with it. I mean, let me explain
Absolutely.
you theoretically. So what happens is that, God forbid, if there are 2 countries and there's war going on in between them, obviously both the countries have to send their forces to the borders. So this is, this is the entire process. So if you are not going to send your army onto the border to defeat diabetes, I don't think that you will be a winner. So what you need to do is that you really need to take all of those precautionary steps which the doctors tell you or share with you. I've seen a lot of people taking the doctor's advice for granted, and then later on their family and the people who are around them, they are actually very sad because of the fact that diabetes, it's a fact, ladies and gentlemen, it has taken a lot of lives, and we want to save all of those lives which can be saved by early intervention, and the advice is given by the doctors.
Absolutely. So without
I
further
think I'm
ado,
doing a great job
no,
today.
you actually explained it very well. I
Thank
think
you.
it's relatable for a lot of people out there. So without further ado, we shall be introducing our very apt panel of guests over here.
Exactly. So,
Shazad,
so to
please.
speak about diabetes, ladies and gentlemen, we've been joined by Dr. Nusrat Hamid, who's a consultant diabetologist. Hello, ma'am. Assalamu alaikum. How are you?
Very good, thank you.
Thank you very much for joining us.
Thank you very much for having me on your show.
Our pleasure,
Thank you.
ma'am.
And alongside Dr. Nusrat, ladies and gentlemen, as we all know that people who actually suffer from diabetes, they have multiple issues, and one of the most common is that they get injuries, especially in their feet, and if they do not look after that, their feet are actually amputated or legs even.
God forbid.
So yeah, so we want everybody to be safe. We want them to wear those safe shoes. We know that you are actually supposed to look after your feet, but how is something which will be told by the diabetic foot orthotist, and he is none other than Kamran Salim Aman. Hello, assalamu alaikum, how are you?
Walaikum assalam, and thank you for regurgitating that mouthful, whatever this is.
Orthotist.
It's a difficult thing for people to pronounce it, but I'm an orthotist by profession.
Thank
So
you very much
thank you
for
very much
joining
for
us.
having me.
Wonderful to have you. And ladies and gentlemen, it's not just feet which are at risk. It's the entire human body and the organs where the blood flow goes. But other than that, one of the very most common other problems are that people lose their sight. And it just happens like that, and then you can never get better if you're not going to look after it. I've seen people go through it. They lose like half of their sight, or they cannot see. It's just different and different angles as well. So to talk about all of that and how to maintain your sight and a healthy sight is something which we would be interested in. And to talk about that, we're very thankful to our consultant eye specialist, Dr. Tahir Masood. Assalamu alaikum. How are you?
Walaikum salam. I'm fine. Thank you for inviting me here. I'll be discussing quite a few important things about eye care related to diabetes today.
Thank you very much.
Thank you so much, and we cannot wait to begin. So I will ask you, ma'am, to please give out some prevalent stats of existence of diabetes in Pakistan.
Right, absolutely. The Pakistan Prevalent Survey stated in 2018, these are the figures I'm quoting from then, that over 22 million people in Pakistan actually have diabetes, and 14.3 million people have
Yes,
Yeah.
please go on.
pre-diabetes. Pre-diabetes is the condition that is leading on to diabetes, and these are the group of people that can avoid diabetes. We can prevent diabetes from happening in these people, and that's why I'm quoting those figures. Men and women are equally affected.
Oh, all right.
For diabetes. There's
And
no
you
difference.
mentioned more than 22 million people.
People already have the disease.
Such a huge
It's
number.
a huge number. It actually comes out to 1 in 5.
Wow.
So that's a huge number. These are IDF figures from
That's
last
like
year.
10% of our population.
1 in 5. It's a huge number, and we're seeing it in younger people. We're seeing it in people with family history or without family history. So it is really alarming, and that's why this is a very important campaign to
Absolutely.
bring forward. And the theme for this campaign this year, as it was last year, is diabetes in the family.
Yeah.
Because without family support, you're not able to look after such a huge condition and a huge health
Exactly.
risk.
Thank you very much for sharing
Yeah.
that information. But then at this point, I think what is very important is that we actually, or we should target people whom we can save from diabetes.
Yeah.
So
Absolutely.
let's talk about prevention. How can we do that?
Absolutely. First of all, it's to know your risk. Okay, I'm as an individual, I should go and calculate my risk. How much of a risk do I have of developing diabetes? Am I overweight? Do I have a family history? Do I have high blood pressure? Do I smoke? So all of those tick boxes, we need to think about those. But telling at this stage is that being Pakistani, simply being Pakistani, we're in the high ethnic risk group.
Yeah.
So I would say anybody who has any sort of suspicion whatsoever should get a simple blood test.
High
Yeah.
ethnic risk group.
Risk, yes.
Why, how?
Southeast Asians, we know they have it's genetic.
Okay.
We have a risk. And when we talk about obesity, the cutoff for a good BMI, that's your body mass
Yes.
ratio, for Europeans and Americans is 25. But for us, it's less. It's 22. It should be less
Okay.
than 22. So slimmer people in our area, in Pakistan, in Bangladesh, they tend to get diabetes
Yeah.
at an earlier stage.
All right.
And so we need to be really, really fit. And in actual fact, we're the opposite.
Exactly.
We take things very, very casually.
Yeah, thank you very much for saying that too as well. That's quite a lot of information, ladies and gentlemen. And speaking of that, Okay, so obesity is one reason, and
Absolutely.
you just mentioned smoking as well. Can
That's right.
smoking
That's right.
actually add on to
It's 2 to 3 times more common. Diabetes is 2 to 3 times more common in people who
Who
smoke.
smoke.
Who
Oh,
smoke.
right.
Okay,
Yeah.
but what about people who consume a lot of sugar?
Absolutely, because people who consume a lot of sugar are going to gain weight,
Yeah,
and that
yeah,
leads to obesity. That leads to diabetes.
Okay.
Okay,
So,
and
so
that's
ladies
how-
and gentlemen, I think that these are the things which you really need to be careful about. And yeah, for all of those Pakistani mothers who are out there who just keep on feeding their kids and they have no idea actually, you know, that their kid is actually getting fat. And if somebody is going to tell them that your kid's getting fat, how hai nazar lagaoge mere bachche ko. So, no, I think that we need to change these things. And
True, true.
yeah, I kind of get into a fight with my wife almost every day because and I tell her
Yeah.
that, you know, that the kids actually need to
Our
look fitter,
concept, yeah.
not fatter. You know, that's the concept. But I don't know what
Our
to say to the
concept of
mothers.
good health is you
Mota.
should look plump.
Right,
You should
absolutely.
look plump and not fit. Fitness, isn't it? So and the other important thing that leads on to diabetes is sedentary behavior. You know, our lifestyle. We don't like to move a lot. We don't
Yeah.
like to go into sports. We like to drive to work. We like to sit at a desk 9 till 5, and then we like to drive back home only to sit at our couches and watch TV.
Okay,
Go
so,
to bed.
so
And
which
very
is why,
widely accepted, yeah.
yeah, so which is why I'm just going to ask this. So for all of those people who are very active, who have an active lifestyle, who go to the gym, who exercise, who are not
Yep,
obese, are there any chances that they can actually get diabetes as well?
Very, very slim.
Right?
Very,
Oh,
very slim.
okay.
Okay.
Yeah.
Okay,
And
that's
these
a
are
good
proven.
sign.
These are proven studies. Worldwide studies show this that diabetes is prevented in more than half of those people who follow a healthy lifestyle,
Okay.
even if they're at risk.
Okay, absolutely amazing. So we will talk about what lifestyle is healthy
Yeah.
lifestyle, of course.
Yeah.
But moving on to you, sir, you know, we're talking about how there's a sort of an accepted culture in Pakistan of denial about diabetes or obesity, starting from, of course, obesity. So you, being a foot orthotist, what kind of people do you deal with? Are they really open to the idea of, you know, them developing any sort of, let's say, injuries and then you dealing with it?
By and large, if I have to give an opinion, that is that most of the patients who come in with foot problems, they have to be counseled rather than treated.
Oh, okay.
Because see, if you change your mind, maybe it's much easier for you to tackle the problem at hand.
True.
And usually the people who are in denial, invest less time and effort into treating the problem that they have. So we first of all have to really train them to accept this, that they do have diabetic foot ulcers, and then the treatment starts from there. But most of the people that we receive in our clinics, they are not open to the idea that they have diabetes right now. So this is the first aspect, and the second would be
Sorry, so what you're trying to say over here is that people come with foot issues to you and then you tell them that you might be diabetic, so go get yourself tested. Is that how it is taking place?
yes, most of the times it is like they do not even know that they are diabetic.
Okay.
But there are a lot of people who know that they are diabetic, but still are unable or are
To accept
unwilling
it.
to accept that they have a diabetic foot ulcer.
Okay.
And those kind of people are really difficult to treat, because whatever modality that you employ
Yeah.
or deploy, they are not going to follow through with it, and that
So
becomes
then-
a problem.
So then you might be under a lot of stress then.
I am under a lot of stress because I've been working now for a year, and I've seen a lot of cases who have went southwards just because they are not able to follow the advice that is given.
Yeah.
And I think we've got to change this behavior. We've
And
got
what
to
and what's the worst case scenario for a foot ulcer?
amputation, that
That's
your
it.
foot will be cut.
Oh.
And
It's
if
the
you
worst
do
case
not
scenario.
and if you do not go to the doctor in time, it can actually reach out to your leg and then move upwards.
Move
as well?
upwards, and it can get worse. First just the foot, and then below the knee amputation, and then it can increase. Some of the people have had their hemipelvectomies, like half of the hip bone also cut
Right.
because of that. So yes, it is a problem that has to be addressed, and I think more psychological rather than the physical aspect
Or
of
the medical.
rehab.
Okay. But
Yes.
how commonly occurring are these diabetic foot ulcers?
It has been seen that 15% to 20% of the population of diabetics is going to end up having foot problems of some way, shape, or form.
Okay.
And out of those, about 20% are going to end up in amputation.
Oh,
And it's still a large number.
it is
Yeah.
definitely.
Yes. And unfortunately, there are not many specialized clinics where the treatment would be given, not many specialized people which would be able to carry out this. And you know, when we talk about rehabilitation, for example, for people with diabetic foot ulcers,
Yep.
it is not just the competence of the clinic
Yeah.
that is the question right now. It is also the accessibility, because once you have the foot problem, you're bedridden, and there is somebody who's going to take care of you in the family, and even he is going to be going off work. So it is basically a lot of pressure, and
Yeah.
it's a drain on the pocket of the whole family.
Right,
So
absolutely.
yeah, these are the two aspects that I think are very important.
Right, but just one more very simple question. You know, since we're talking about diabetic foot ulcers, what other factors other than negligence might cause these? I mean, since you mentioned there's hardly 15 to 20% of the diabetic patients that may develop these.
I think what causes is basically the hypoxia, which is the, you know, because the blood is not flowing properly,
Okay.
and the oxygen is not being given to all the different tissues of the foot.
Yep.
So every tissue of our body requires oxygen to be alive, to remain
Right,
alive.
Yeah.
And if there will be any, you know, any reduction of oxygen or indirectly
Yeah.
of blood, it is going to become ischemic. It is going to die.
Right.
So any appendage in the body is going to, you know, just die because it will not be getting oxygen and blood.
Exactly. Thank you very much for saying that. And you know, ladies and gentlemen, adding on to that, the same is the case with your eye, same is the case with your brain, same is the case with every other organ in your body as well, because the blood actually goes to each and every organ supplying oxygen, which is why I'm going to move on to the thyroid, where we've seen a lot of people ending up in comas, we've seen a lot of people losing their sight, we've seen a lot of people damaging the back film of the eye as well, because the blood flow does not reach to that point. And there are no proper solutions for that. I've seen it because even though that my father is not diabetic, but one of the incident took place and half of his eye cannot actually see now. So what do we have to be careful about if, God forbid, we are diabetic?
Right. So I'll just start by quoting some figures. We were talking about some figures. So I think it's very important to realize how big a problem this actually is. The fact that the eyes are involved in diabetes. So of the millions of people that are that have diabetes worldwide, so about 1/3 will have some form of diabetic eye disease.
Yeah.
So there are different ways in which the eyes are involved, and the combination of that is called diabetic eye disease. So 1/3, which is quite a big number actually, and out of that number, another 1/3 will have vision threatening, so they can actually lose their vision.
Okay.
To the extent that they'll be either blind or partially blind,
Yeah.
and then that's a life without vision is very.
And that's not reversible, right?
That's usually irreversible.
Oh,
Okay.
And then you have people who are visually disabled in your society. So I mean that has huge psychosocial and economic implication. So basically, the important thing is that diabetics, if they have poor diabetic control,
Yeah.
and if they have been diabetic for a long period of time, and if apart from diabetes, if they have hypertension or some of the other risk factors that we were discussing, then they will definitely get diabetic eye disease.
Okay.
So what are the main forms? So basically we were talking about all this circulation and the fact that diabetes affects that. So the back of the eye, the retina, is very, very delicate tissue. And you start developing some changes. So we call that diabetic retinopathy. So abnormality in the retinal blood flow.
Yeah.
So the blood vessels can either be blocked or they
Yeah.
can become leaky.
Okay.
And there are associations, there are patterns. So people who have type 1 diabetes,
Yeah.
they will develop abnormal blood vessels that can bleed. People who have type 2 diabetes, they can have leakage, so we call it diabetic edema. In either case, they will eventually lose the vision. So the key thing is to pick this early. So that is, in diabetic eye disease, the key thing is screening.
Yeah.
Okay.
So internationally now this is accepted and this is recommended. All diabetics, whether they're children, adults or elderly, they need annual mandatory eye screening.
Right.
that's
So
the key.
here's my question. So you mentioned that diabetic eye diseases, they sort of develop later on after you have been diagnosed with diabetes for a
Yes,
very long time.
yes.
Is it possible, or has it happened that you might have a problem with your eyesight and then you go to the doctor and he's like, hey, you have diabetes?
Many
Yeah?
a times, many a
Okay.
times. Unfortunately, we've seen this. People have come with some kind of visual complaint,
Okay.
and we look at their eye, and they've got florid diabetic retinopathy. So
And
we
they
would-
don't know about it.
They don't know, and we say, "Do you know you're diabetic?" And we're surprised at times that they're not aware of this.
Exactly.
So sometimes that can happen. Diabetes also causes early cataract. So our natural lens becomes cloudy and opaque with age. So diabetics tend to get that at an earlier age.
Okay.
So that's one thing. Similarly, glaucoma, there's another very serious blinding disease in which
Yes.
the eye pressure raises, and then again it causes irreversible damage to the
Yeah.
optic nerve. So there's association with diabetes, and diabetics tend to get that more often.
Exactly.
There are some rare kind of things that it can affect the nerve supply to the muscles. So some people will come with double vision because their eyes are not moving properly.
Yeah.
Okay.
And there are some milder things like you can have dry eye. Diabetics often get dry eyes. But the main thing is the retina is a very delicate tissue. Unless you diagnose a diabetic retinopathy early, you will not be able to treat it. In the early stages, it is completely treatable and preventable, the consequences.
Well, that's great.
Okay.
But before we move on to Dr. Nuzul, ladies and gentlemen, I think that it is very important to let everybody out there know that we over here in Pakistan do not have a culture of going to the doctor, visiting or getting ourselves tested, or going through all of these screening processes, even after 6 months or even after a year's time as well. So this is something which we really need to be careful about, because for all of such instances, what we have seen in different cases is that once it happened, that's the time when they went to the doctor and it was too late.
Right.
So but there might be some early symptoms, if we're talking about eyesight or our eyes or the retina. Well, what do you think that a diabetic person might feel around his eyes so that he can actually go to the doctor and get himself checked up?
So it's mainly blurred vision actually. So as I mentioned, there are some very early changes that happen even before you get visual problems. So that's where the screening comes in play. But many a times people just come to us as Dr. Nuzul was talking about culture and the way we behave. As Pakistani, we often come when we actually have a problem. So people will come to us when they've noticed blurred vision. So that's the main thing.
Okay.
And then it can be
In both eyes or in one eye, so it can be different.
Can vary.
This is again very tricky. If you have very good vision in one eye, there are very few people who would daily check their eyes separately. We rarely do that.
Yeah.
So many a times people come and we are surprised they've got very advanced eye disease in one eye, but they haven't noticed it because the other eye is working well.
Yeah.
So it's often blurred vision, and as I said, because cataract and diabetic retinopathy, they would give you blurred vision.
All right.
Okay.
So, but we want to act before actually that stage. That's
Yeah.
the key thing.
Right.
Okay. So yeah,
right.
so
Because
ladies
that-
and gentlemen, you just get yourself tested and get yourself screened for diabetes as well.
Right. Shazad, remember this was probably last week when we were discussing about regular checkups and how
Yep.
this is not a common practice in Pakistan. And we sort of gave an idea that maybe this can be an annual thing on your birthday or on the New Year.
Not
you
on
can
your birthday.
No, it's an idea, come on. This can be a reminder to yourself, right? It's my birthday, hey, let's get checked up. But I mean, even once a year, I don't feel it's enough. So probably you can do it twice, when it's half your birthday and when it's entirely your birthday.
No,
It's
but
a
the only-
suggestion.
Yeah, but the only reason why I'm saying that, it shouldn't be your birthday or the day when you get yourself tested, because
Not
the
exactly
reports
that
came
day.
in and the reports weren't fine. And, we do not want people to think that it was their last birthday, so please don't do that. Let's not be so tragic. But
Okay.
ma'am,
Yes.
so there are a lot of myths going around.
Yep.
I've seen people who are not very well educated, and they're
Sorry.
not very well aware of their condition.
Absolutely.
So they go to the doctors, the doctor tells them to inject insulin, they inject insulin, and then they go on eating like Shrek. So, that's a very common problem. And
It
then
is,
people
it
say,
is.
oh, मैंने तो टीका लगा लिया तो अब मुझे कुछ नहीं होगा.
Yeah.
They think that they're
License to
invincible.
kill.
Yeah. Yeah. But so can you speak about a little about all of these
All of these
issues
myths.
which exist?
I'll tell you. You're absolutely right. This is exactly what happens. Some people will actually come to us and ask for insulin when they don't need it.
Okay.
And when we explore the reason why they want the insulin, it's just because they want to enjoy food,
Yeah.
because they love food so much. And we say that, we can understand it's a drastic change. in our lifestyle. You know, everything revolves around food.
Yeah.
Like we celebrate with food. If there's, God forbid, there's a death, it's with
We even
food.
put, you know, even on birthdays, we put cake on the face. We do not eat it. You know, we celebrate.
Exactly.
Yeah.
So food is a huge part of our lives. You know,
Right.
let's be honest. So they feel left out, and this is why this campaign about involving the family with the patient or with the diabetic person, you need support. You need support from everybody around you.
Absolutely.
So it's difficult to change. It's easier said. It's easy for me to say, go home and change your lifestyle.
Yep.
It's not that easy. We're creatures of habit. We need to change things step by step. As long as we're going in the right direction, inshallah, we can't go wrong.
Yeah.
And those steps would be not to make food such a huge part of our,
Right.
you know, we don't go on healthy outings. We don't go on picnics anymore. We don't go out play sports. We don't go on family trips. What we would now do is dine out. That would be our
Yeah,
quick
yeah,
and
that's
easy, you know, fix. And we need to try and change that culture a little bit.
Exactly.
All right.
So the insulin and things that you're mentioning, people have huge weddings. You know, we have lavish food set out. How can we resist that food? You know, come on, let's be honest. We would like to give ourselves insulin as well,
Yeah.
but it's not the right thing to do
Exactly.
because you eating more and injecting huge doses of insulin is going to make you gain even more weight.
Oh,
And there will
okay.
come a stage when you'll have huge doses of insulin and they won't work.
Right,
Okay.
right.
They
You
won't
might
work.
become
So you'll
immune
be
to
in
them
bigger.
as well.
Exactly.
So are you trying to say that taking extra insulin can actually be dangerous for people
Absolutely.
who are diabetic?
Absolutely.
Really?
Yes, absolutely.
Okay, so yeah, you know, this is
Overdosing
something
on it.
Yeah, you cannot overdose on it.
You can overdose on it, and you can have very lethal
dangerous.
results, like
Yeah.
low blood sugars, and you know it's instant death.
You know, and I seriously do not like it when I actually have to be an scapegoat to so that we can get the information across as well. So, ladies and gentlemen, please make sure that you do not abuse insulin. First of all, do not abuse food, and then do not abuse insulin. Yeah, I
Absolutely.
think
Right,
these
but
are
now
important
since we're
things.
May I
talking...
add something?
Sure,
Oh, please.
I think it's very important for all the people who are on injectable insulins to understand that it is something dangerous if you overdose.
Yeah,
Yeah.
So it's not something that has to be done casually.
yeah,
It has to be measured properly. Your doctor has to be all the time in the loop.
yep,
And this is very important because you even have to go to a good doctor,
yeah.
because there are some cases here, including in my family,
Thank you very much for
where
saying that.
where you know they've been misdiagnosed and
Yeah.
they've been given insulin when they did not need insulin,
Need it, yeah.
Oh.
and they are at a very, you know, real risk of having coma.
Exactly. Thank you very much for saying that. And ladies and gentlemen, this is something which I've witnessed myself as
Yeah.
well. That I don't know, you know, I think it's in between the doctors, so let them sort it out themselves, you know. So you go to one doctor, you get yourself checked up, he's going to give you medicine, then you go visit another doctor, you know, for an opinion, he will be like, okay, which doctor did you go to? And then you'll be like, oh, no, he does not know anything, you know, just take this medicine. So this is something which doctors actually need to
That
resolve
is
amongst
something-
each other, you know, because you cannot be spreading such confusion amongst people which is directly related to their life and death issues. So please make sure that you don't do
Right,
that. At this
absolutely.
point of time, we're going for a short break. Don't go anywhere, because when you guys will come back, we actually need to look after our feet. You know, the type of shoes we wear, I don't think are actually supportive for all of those people who are getting foot ulcers. We'll speak about that. Let's
Yeah.
do that.
Stay tuned.
All right, ladies and gentlemen, welcome back. For everybody who just got tuned into PTV World, you watching World this morning alongside Shiza Hashmi and Shahzad Khan. Today is 14th of November, which is actually the birthday for Dr. or Sir Frederick, who actually found insulin, or co-founded insulin with Mr. Charles as well. But ladies and gentlemen, when we were speaking about it, or you know, earlier when we were going towards the break, there was this one amazing problem which came under discussion. I'm not going to say amazing, but this is a problem which still
The
exists.
magnitude is large.
Yeah, the magnitude is large, that every other doctor you go to when you're getting your diabetes checked out, specifically I'm focusing on diabetes, that every other doctor you'll go to will have a different medication to prescribe. And this obviously results in a lot of confusion. I've seen patients who have given up on medication totally, you know, resorting to other solutions, probably, you know, dam darud and, you know, all of that. You know, it does work. We're not saying that it does not, you know, for people who are full of beliefs or faith. I think that it does work for them. but you really have to do it religiously as well.
Right,
But other
but
than
adding on to
that, I think that the doctors need to find a resolve amongst each other. And is that possible or not? I'll start with you, Dr.
Yes.
Nazim.
I think that's a really good question that
Thank
you're
you.
asking, because we come across it all the time. What my advice would be that you go and see a person who deals with diabetes specifically.
Yeah.
Like myself, I'm a
Diabetologist.
diabetologist. I see diabetes day in, day out.
Yeah.
And I keep myself updated about the new guidelines and everything. What happens in Pakistan, unfortunately, is everybody likes to do a mix of everything.
Yeah.
Myself being a diabetologist, I wouldn't want to look after your heart. I could do, but I wouldn't want to do it.
Yeah.
Okay.
Okay. And the same goes for any other field. Like, we need to refer more. We don't have that culture a lot. So if a patient comes to me, I'll try and look after everything, which isn't right. So my advice would be go and see somebody who looks after diabetes specifically, and then you can't go wrong.
Okay.
We all have differing opinions, which are confusing. I can admit that. I might be more lifestyle prone. I might prescribe you less medications. My colleague might be more aggressive with the medications.
All right.
You know, that's our different trainings. You know, different training backgrounds. I'm UK trained. Somebody might be American trained. But at the end of the day, always discuss with your doctor. You have to see a doctor who's willing to discuss your treatment with you. You have every right to ask questions. You have every right to ask, why am I given this medication? Can I do without it or can I not? Every right. And if a doctor doesn't discuss with you, then I don't think that's the right doctor to go to.
Okay.
Right, absolutely. You know, the importance of actually going to the right doctor, like you very rightly mentioned. I mean, for getting my diabetes checked, I'm not going to a cardiologist and, you know, going to him like, you know, just treat my diabetes because I have developed it. And one other very common practice, one of our cameramen actually mentioned it. You know, when you're on the roads, a rickshaw or something is in front of you, it will say, sugar ka ilaj, flani gali, flana mohalla, apni dawai aaj lein. I mean, why do we have to believe in such things without getting proper research on it, without going to a proper person with, you know, the same area of expertise? Why do you have to allow someone to play with your, I mean,
I have actually
anatomy?
got a very similar story to share. So, ladies and gentlemen,
Did you
know,
call the number?
Men over here in Pakistan, you know, they're said to be very dominating and whatnot. But you know, everywhere you go in Pakistan, there's one thing written on the walls all over, all around Pakistan. And I think that, you know, people resorting to such solutions is somewhere where we need to intervene, where we need to educate, where we need to make them self-aware as well. This is something which can be very dangerous for you in near future too. So please make sure that you resort to people who are actually qualified to do such treatments as well. But at this point of time, we've actually got a report for you to go ahead and take a listen and take a look. And when you guys will come back, we'll wrap up the show. We'll actually ask how to keep our feet in good health and our eyes as well if you are diabetic, unfortunately. Let's do that.
World Diabetes Day was created in 1991 by IDF and the World Health Organization in response to growing concerns about the escalating health threat posed by diabetes. World Diabetes Day became an official United Nations Day in 2006. With the passage of United Nations resolution, it is marked every year on 14th November, the birthday of Sir Frederick Banting, who co-discovered insulin along with Charles Best in 1922. WDD is the world's largest diabetes awareness campaign, reaching a global audience of over 1 billion people in more than 160 countries. The campaign draws attention to issues of paramount importance to the diabetes world and keeps diabetes firmly in the public and political spotlight.
I'm one of a kind because I'm a mother, I'm a wife, I'm a friend, I'm a daughter, I'm a healthcare professional, I'm a psychologist, I'm a diabetes educator, I'm a researcher, I'm a PhD student, I'm a diver, I'm a sailor, I'm a runner, I'm a traveler. I am who I want to be, and diabetes has never stopped me.
Welcome back, ladies and gentlemen, from a very tiny, weeny break as well. But before we went to the break, Dr. Tahir actually wanted to add to the conversation. I don't know why during the break he's actually taken his spectacles off as well. But let's ask him. Yeah, Dr. Saab, please go on.
Right. I just wanted to add on to something very important that you were discussing earlier, and Dr. Nuzhat also added on to that. Both myself and Dr. Nuzhat, we worked in the UK in the National Health Service. So I've come back in 2015, and since then I've been working in Pakistan. So one of the main differences I've noticed is that unfortunately we work in isolation. The doctors work in isolation in Pakistan,
Yep.
especially if you're in the private practice. So in the UK, if you have a patient, there may be, because as doctors we're individuals, we have different opinions. We might want to treat the patient in a different way, use different treatments, but the doctors always consult each other
Yep.
regarding the same patient, regarding the same disease. If there's a difference of opinion, multiple meetings are held so that you can kind of decide on one single plan of treatment, and that treatment plan is discussed with the patient.
Yep.
So the patient say is also very important. You might want the patient to have insulin. What if he says, I don't want insulin? You cannot force anyone to, so you have to counsel the patient. So the problem in Pakistan is everyone is working in isolation. Sometimes you're wrong.
Yeah.
So it's very important that you, even in your private practice, I do this a lot. If I come across a patient, I'm not too sure, I'll pick up the telephone, speak to my colleague and just say, can I send this patient over to you? Please
Exactly.
have a look, let's treat this patient together.
Yeah.
Right.
And that way we can help the patient and their disease.
Exactly, and that's a great idea as well. So pretty much, ladies and gentlemen, it comes from a doctor's mouth and goes into a doctor's ear too as well. I hope that it does go there as well. But very quickly, before we wrap up, there's one more common issue, and that issue is that I've heard a lot of people saying when they get foot ulcers, or just get them bandage, or do not put bandage on it, do not put water on it. So there are a lot of things which go around your foot ulcer as well. So what are the right things to do if in case you have a foot ulcer?
If you have a foot ulcer, you have to keep in mind, first of all, you have to have a proper diet.
Yeah.
That's important.
Okay.
That you have enough protein in your diet, so that it heals up. But I think the most important thing is offloading. Whenever you have some kind of an injury on your finger or any other part of your body, you baby it. You don't let it touch. But unfortunately, foot is a kind of structure which will always be under pressure as long as you're walking.
Yeah.
Right.
So what you have to do is you have to offload the wound. That's the first thing. The second thing is for an open wound, you need to keep it dry. Yeah. So you can wash it with normal saline, but then you have to completely clean it,
Yeah.
for any exudate or anything like that. Other than that, I think it should be, yes, it should be bandaged, of course, but then you should also consult a specialist because, those are the people who are really adapt to, taking care of the diabetic foot, because diabetic foot ulcers are treated in a totally different way as compared to a normal ulcer.
Okay.
Oh,
All right.
right.
So you have to have a specialist, who will take care of it because there will be debridement and a lot of other things, that have to be deployed. I also think that ill-fitting shoes are the major cause of these problems, and we should also have shoes that are not really cramping the foot for space.
Yeah.
And of course, you have to consult a good orthotist like me,
Exactly.
to have a proper footwear.
Yeah.
This is also very important. The third thing is usually when you have diabetic neuropathy, you cannot really feel the difference between hot and cold, and it becomes very difficult, or it becomes dangerous for you to sit in front of open fire, trying to warm yourself up. There are a lot of cases where people have already burnt their feet and have ended up in gangrene and at the end amputations. So those could be avoided. It's better to have
Avoid
warm clothes.
Avoid walking barefooted as well.
And absolutely, because usually these patients, even if they have a nail going into their foot, they will not know for 3, 4, 5, even when
Exactly.
it is there for a month, unless it really bleeds and it's very obvious. So these kind of patients are really at risk. That's the reason why they should always be having proper footwear.
Exactly.
Even at home, they should not be having very soft footwear, because even things can pierce. And then when they're putting on their shoes, they should be inspecting for pebbles or any foreign particle, because that is going to hurt
Right.
with abrasion. The foot.
Well, that's great. Well, thank you very much for being with us. It was wonderful to be in conversation, and I feel very amazing that there is a team of doctors who are actually working for people who are diabetic and to make sure that they're going to get better. Thank you very much for being
Thank you
with
for
us.
having
It's
us.
lovely
Thank
to
you.
have you.
Thank you.
And you know,
having
ladies
us.
and gentlemen, thank you for watching, but I cannot stress this enough. You really have to go to the right person for diabetes. I mean, you cannot just go to a general physician and he'll be like, hey, I'll try, cure your diabetes. I mean, imagine we're talking about diabetes and we have a dietitian, we have a foot orthotist, we have a eye specialist, and their team also constitutes of a nutritionist and a cardiologist.
Yeah.
So imagine you really have to go to the right expert person for this if you care about yourself.
Exactly, and please make sure that you get yourself screened. You make sure that you get your checkups regularly as well, because ladies and gentlemen, once you get it, I think that it's very difficult to, because eventually it is new to you. It is very difficult to pick up with the routine, and the dietary habits will change, and everything's going to change. So isn't it better that we look after ourselves? Because it's always good to be on time than rather to be late. I think that's what it is. Stitch in time says nice. That's what we are going to talk about. But please make sure that you write to us on our Facebook page, which is with the name of
Well This Morning.
on Twitter,
Well This Morning without a G.
on Dailymotion and YouTube,
Also Well This Morning,
and the fabulous repeat's going to be
5
at.
past 11 p.m. tonight.
Yeah, and just remember that this year's theme is about family, so it's the family members who are actually going to look after and intervene if they think that there's something wrong with their son or daughter is doing who's diabetic. Please make sure that you look after your loved ones. Goodbye. Good morning.